Thank you, Dr. Luber, for that nice introduction. Good morning. It is indeed an honor to be here with you and to be chosen to moderate such a distinguished panel. Perhaps you know, after 30 years of law enforcement, that officer safety is something that's near and dear to my heart. Unfortunately for me, I have had the occasion to have some 4 officers under my command die in the line of duty. And so it obviously is something that we work to do all we can to prevent. Also very proud of the work of NIJ and the IACP, particularly in looking at this issue from a partnering perspective and bringing this issue to a point of strength as we try to deal with the issues and solutions to the various issues and problems. The body of work and the research that's done by NIJ, the formulation of policies, the look at the science of criminology, technological advances, and looking at such things as body armor have been important in our efforts to deal with officer safety issues. These are obviously, all of those things are important priorities if we're going to do our best to reduce the number of officers killed and are injured in the line of duty. As you perhaps know, some 53,000 law enforcement officers were assaulted in 2010. Last year, we had something on the magnitude of 177 officers who lost their lives. That's a 16% increase from 2010. 72 of those officers killed were feloniously assaulted. And so far this year, we've had 36 police officers who have died either through assaults or in traffic crashes. For me, the major issue has been, what are we doing about that? And specifically, what is the IACP doing about those circumstances? And I'm happy to share with you this morning that the first priority of the IACP during this year has been to focus on officer safety. And it's been an ongoing priority of the organization for many years. To address officer safety, we also know that we cannot do that work alone. It requires partnerships like the one we have here with NIJ. We are currently partnered with the National Law Enforcement Officers Memorial Fund, DuPont Corporation, and the Bureau of Justice Assistance, along with the FBI Law Enforcement Officers Killed and Assaulted program, and many more leading officer safety organizations. With these partners, we are addressing all aspects of officer safety. First and foremost, the 50,000 officers feloniously assaulted every year, and the 72,000 killed by assaults in 2011. One of our major initiatives is to reduce these deaths, and reduce these deaths in programs like Saved by the Vest through the DuPont Corporation. I have you noted in recent years, over 3,000 officers have not died, and they have not died because the bullet struck the vest instead of their bodies. We in the IACP have recently created the Center for the Prevention of Violence Against Police to study felony assaults and provide guidance to the field in terms of how we can reduce assaults against police officers. We are working hard on traffic safety. With 66 officer fatalities in 2011, this problem has not gone away. And perhaps one of the issues that we're tackling in the IACP that some have said they'd rather not see us tackle has been the issue of police officer suicides. Suicides continue to be a take a significant toll on police departments around the country, with over 150 officers dying by their own hands in 2011. To address this tragic loss, I am proud to announce we are joining forces, we the IACP, are joining forces with the COPS Office on a national officer suicide prevention initiative with a bottom-up line perspective, and we're looking at making sure that mental health, wellness are a key focus in all 18,000 law enforcement agencies across this country. Our belief is that if you can't talk about mental health issues, then it's virtually impossible to get help. Folks, looking at all the injuries, thousands of officers hurt in terms of injuries to their backs, sprained ankles in an annual way. We're also conducting an officer injury study with BJA to determine how these injuries can be reduced through policy and training. All these initiatives at IACP fall under the flagship efforts of our Officer Safety and Wellness Initiative that we very fondly refer to as Project Safe Shield. And to that extent, let me point out Scott Bryan, project manager. Scott, why don't you stand up, let folks see you. And Steve Fender, project coordinator with the IACP National Center for the Prevention of Violence Against Police. And I wanted them to stand so you could see who they are, so that perhaps you get an opportunity sometime today, perhaps after the session, to engage them in some conversation about the good things that we're doing to try to save lives of our men and women across this nation who try to patrol and police our communities. Now, what is this panel here this morning about? And I'm excited about this panel. I have had the good fortune this morning of having some conversation with all of our panelists here, and I'm really excited about what they're going to share with us today. Today we'll be discussing some of the NIJ's most promising work to reduce shootings and traffic-related fatalities, which are consistently the leading causes of officer line-of-duty deaths, and what can be done to improve police officer wellness, which is inextricably linked with officer safety. I am very proud this morning to have the honor and the privilege of introducing our panelists. First, we have Dr. Brian Vila, professor at Washington State University, Spokane, Washington. Secondly, we have Dr. Corrick Williams, associate professor, Mississippi State University, Starkville, Mississippi. We have with us Dr. Karen Amendola, Chief Operating Officer, Police Foundation, Washington, D.C., and a man that I just had an opportunity to meet this morning who is going to talk to us about police officer suicides, and that's Dr. John Violente, Research Professor, University of Buffalo, Buffalo, New York.